Now,
Good morning.
Lynne, let's start off with you. UNAIDS, the global UN body for HIV/AIDS, recently announced their new strategy of 90-90-90. Can you please explain to us what this actually means?
Yes, of course. It means that we want to make sure that 90% of people that are HIV positive are tested so that they know their status. And then we want 90% of those people put onto ARV treatment. And the last 90 is to make sure that the 90% that are on treatment are taking their treatment properly every single day of their lives so that their virus is suppressed.
Now, Lynne, South Africa has 6.8 million people, over 10% of our population living with HIV, but only half of those are currently on treatment. And every year, another 330,000 new infections, mainly young women between the ages of 15 and 30 years old. That's the highest number of new infections in the world. Realistically speaking, how does a country like us in South Africa achieve the UNAIDS 90-90-90 targets?
It's a good question and probably $1 million question. But really for us it's possible, but it will require a lot of hard work and a change in strategy. Essentially, we need to be able to move out of our clinic systems into our communities. We need to make sure that if we're going to test 90% of people who are HIV positive, we can't be relying on people to go into their clinic and sit there for half a day to get an HIV test, or stumble upon a random HIV outreach testing in your community. We need to make sure that testing is available for all of us at every corner so that we can all test regularly, at least once every 6 months, so that we know our status. We also need to make sure that we get the message out there to our communities that once you test positive, you need to start treatment immediately and quickly, and not to stay at home waiting for the disease to wreak havoc in our bodies. We need to make sure that we get on treatment as quickly as possible. But that also means that there's a demand on our health system to be able to put people on treatment quickly and not require people to come back repeatedly to clinics without starting them on treatment. And then the last one, that is really probably the most essential, is how are we going to keep people on treatment for life? And that means, number one, we need to make sure that our clinics and our hospitals have a reliable drug supply. At the moment, we don't have that right in South Africa. We cannot rely on the fact that in every single province in this country, we have ARV treatment in every single clinic. That's our number one priority.
Now, it's all good and well.
Our second priority is just to make sure that it's simple for people to stay on treatment.
Yes. Now, Lynne, it's all good and well to have the treatment. My grandmother used to say prevention is better than cure. And the biggest increase in HIV infections is among the youth. In a society that has a significant amount of education on HIV and AIDS in schools and elsewhere, why do you think are we seeing this behavior that people are not adhering?
Well, it's not easy to adhere, and I think that's the critical point. We're trying to continue our lives, and for our young people, that means going to school, creating a livelihood. And if we expect people to get their ARV supply every month or every 2 months by sitting in a clinic for half a day, it's not at all surprising that life intervenes and we start making decisions which might mean that we don't keep fetching that ARV supply. So until we can start making sure that people are able to receive their ARV treatment at a quick pickup point in their communities, it's going to be incredibly difficult to, especially for our young people, to stay on treatment for their entire lives.
Now, Andile, you have been living openly with HIV since 2006. 2008. Can you tell us how this impacted on your life, not only on a personal level, but also with regards to the work that you have chosen to do for the Treatment Action Campaign in getting communities to understand how HIV actually works and how people can then continue to live productive lives despite having the virus in their blood?
Point of correction. I started to live with HIV since 2004. Since 2004, yes. Ever since I was diagnosed with HIV in 2004. Yeah, it was very difficult, but because of the help of education that was happening in our community clinics, like Khayelitsha, where I'm coming from, you know, the educators from Treatment Action Campaign, you know, they were doing such a good job, you know, to mobilize us from the community and then to educate about HIV and AIDS. How does the HIV replicate itself inside the immune system? It really played a vital role. And now I became involved with the campaigns that are taking place within the community and doing trainings for organization, for TAC inside and different organization outside, even the lawyers, the nurses, and everyone. I'm training them now according to the new treatment that we are having in South Africa.
And what is that new treatment?
The new treatment is it's a one pill specifically, not only that one. We are talking about different topics that we are talking at them, opportunistic infections, and also the one pill that we are having in South Africa.
Now, you are also involved in an exciting new campaign facilitated by Doctors Without Borders and the TAC, the hashtag Life Beyond HIV campaign. Share with us the details of this project and how it came about.
Okay, yeah, you know, we were part of that Life Beyond beyond HIV, you know, because mostly, if I can tell you, is that the people living with HIV and AIDS, tech, you know, they were involved, artists were involved. We're sitting down together and give them the ideas, especially the artists, to go back, and they will come back to us and show us, you know, we are here. Even the messages that we have there in that mural painting that is going to be unveiled today is come to us, you know. Even the pictures that you see in the mural painting there is the people from Khayelitsha that are living openly with HIV and AIDS. The main purpose of the thing is was just to educate. If you recall, in the past years, we're doing activities activities about HIV and AIDS, but we needed something that is going to stay long and, you know, for the period of 5 years to 6 years, and then that will encourage other people, you know, to test for HIV and to take treatment, those who are on treatment.
Now, today, Lynne, you in Khayelitsha, tell us about what is happening there today.
So today we're unveiling the murals, which the community, as Andile said, took part in creating the images, and we're unveiling that today. And we hope that the large murals that will tower above Khayelitsha will be a constant reminder to us and our communities that we haven't beaten HIV yet, and we still have a way to go. We need to go in, we need to test, and we need to start treatment. And we need our communities to support those that are HIV positive, because it's not easy to stay on treatment, and we need the love and support of our families, our friends, and our communities to stay on treatment.
Thank you to both of you. That was Lynne Wilkinson, the project coordinator of Doctors Without Borders. She's the outgoing project coordinator, as well as the treatment literacy trainer for the Treatment Action Campaign, Andile Madondile, joining us in our Cape Town studios. But now it's over to you, Evan.
Yeah, thanks, Elvis. We continue our look on World AIDS Day, and specifically now the I'm a Survivor campaign. IMAS is one of the campaigns that's fighting the disease. The campaign has taken a little different approach as it plans to educate the public on their personal risk perception, to drive testing, to reimagine and innovate a new and effective model of support. Also, the I'm a Survivor campaign is building a team of dynamic ambassadors, some of whom are positive and tell their stories in powerful new ways. Others are celebrities that are willing to use their status to spread the message. Now, I'm joined this morning by the CEO of Diamond Life Impact Projects, Jake Scott. Very good morning to you, Jake. Thank you.
Good morning.
Thanks for joining us. Tell us a little bit about the campaign. What makes you guys different?
Well, I'll tell you what's different. You know, all of the reports we've heard this morning, HIV is at crisis levels. The infection, we've made a lot of progress as a nation in South Africa, but the one area where we haven't made a lot of progress is in the infection rate. Still more than 1,300 people every day are becoming infected. The statistic for young women, 15 to 24, is that the estimates are 2,300 every week are becoming infected. This is untenable. So in order to change the trajectory of the epidemic, we must reach young people, and we must seed a new, healthy social dynamic among young people. And so when we look at the situation, we say, okay, with these numbers that are piling on every day, we need to have a plan. This is an environment that's full of a threat, and so we must change our mentality to become survivors. It's very difficult in South Africa to, because of the level of stigma, to discuss HIV. Young people aren't talking about HIV, and if we can't talk about HIV, then we won't be prepared for it when we're in this situation.
Is this where where the new kind of message comes in, where the hero principle, you bring celebrities and so forth to get young people to understand that you can be 15 and be a survivor?
Absolutely. Well, our campaign is targeted to all South Africans to adopt a survivor mentality. The difference is if we look at who influences our youth culture, if you look at celebrities, you look at the music business, you look at entertainment, these are the people that have the most impact on youth culture, and so we need to engage that entertainment factor to spread the message. Now, the way we've laid out the campaign is that we want to do free to the public musical concerts featuring big names. Now, we're still raising the money to do this, but at the heart of our campaign is a song called I'm a Survivor. It was done by a wonderful artist and composer named Valley. It was just showcased on the SABC Big Up show, along with our ambassador, Portia Wayne. And she tells a very compelling story. So when we take entertainment events into different areas, young people, we want to create events that young people crave to be a part of. And if you can do that from that platform, you can then educate.
We understand that young people are most at risk, and that's where the crisis is at here in South Africa. How have they responded to the work that you are doing?
No, young people love entertainment, and so whenever you do an event that has entertainment or you give content that's exciting for them, they do it. Another real key component to fighting this disease is to make sure that there is effective support for people once they are infected. But people should have a plan, whether you're infected or affected, or you're negative or you're positive. People should know how to stay healthy and how to protect your health. We've got a 4-step plan. If you're negative, everybody must take the test and know their status. But if you're negative, you must always protect yourself. Use condoms. Try monogamy. Test together if you're in a relationship. And just never take chances.
Going forward, what's the next step for the campaign? What would you like to see in the short and medium term?
Short term, we have just launched the song, and so we're trying to get as much exposure for the song as possible. And the music video. So we're trying to achieve high visibility for the campaign. Long term, we want to carry this message around the country to young people through events, through media, and through our website, which is imasurvivor.coza.
Fantastic, Jake. Guys, doing fantastic work. Thank you for joining us this morning. Jake Scott is the CEO of Diamond Life Impact Project's I'm a Survivor campaign. Look out for the track, I'm a Survivor, as well. It's launched already today, of course. It's World AIDS Day. We continue with your views on HIV/AIDS, of course, our question today.